So tell me, when you do surgeries, and you cut open a person, can you tell if someone's been smoking? Like, can you actually see visible signs of it?
So, it's very clear that the lungs definitely get very, very affected. And I am a part of the transplant program also, and we do heart and lung transplant. But then the lungs of a person, deceased donor, cannot be taken if the person was smoking, because the lungs are all black and they are all damaged, and they cannot be used in a fresh person, and they cannot be used into a patient. So these lungs are really unusable, because they have got damaged because of these chronic smoking. And also in the arteries, we have seen this, that the coronary artery disease occurs much younger, at a much younger age in those patients who have been smoking. In fact, we routinely see patients who are 25 years or 30 years of age. They come back with a heart attack without even having definite blockages. So this smoke actually leads to clot formation inside the arteries, and that can cause heart attack and damage to the heart without the actual blockage.
Yeah. No, actually, I remember somebody in my family telling me a story that, oh, my grandfather lived till 98 and he smoked regularly. But the funny thing was, when he actually had an episode, there was nothing anyone could do to save him. It was like absolutely the end then and there. You couldn't you couldn't even give him anesthesia. He was just so badly, his organs were just melting away. And the quality of his life was so different as well because of smoking.
So Sonali, we hear this, all the time, that, Dr. Sahab, everybody smokes, and people who are smoking, even they are not having heart attack. Why I had a heart attack? So this is something which is, we have to see in a broader perspective. There is not just one factor that leads to heart attack. There can be, multiple other things, including your family history, your genetics, your blood pressure, sugar, and other things, which can contribute to heart attack. And smoking is one of those biggest risk factor which a person may have. In fact, there are a lot of factors which we can't modify. They can be something like, your genes. You cannot modify that. But the factors which you can modify, that should be modified to an extent that the effect of other factors is negative. So if somebody, despite smoking, did not have a heart attack, that does not mean that everybody should start smoking, because the person may be carrying very good genes and he did not have did not allow smoke to cause heart attack in that person. But not everybody, not an average person has that kind of genes. So and we are talking about statistics here, that if you smoke even 5 cigarettes a day, even that much smoking, people will say that, I don't smoke. I don't smoke that much. I just smoke occasionally. I smoke 1 cigarette in the morning while I'm freshening up, and 1 after lunch and 1 after dinner. Even if you're smoking as little as 3 to 4 cigarettes a day, even then your risk of heart attacks are more than double that of the normal person.
Yeah, and as it is, as Indians, we already are quite high susceptibility to heart attacks, right?
Yeah, definitely.
And I also think that sometimes what we don't talk about is the diet and the exercise of some smokers. Sometimes that is so good that by itself might be negating some of the effect. But,
In fact, that's also a very interesting point. Smokers may have, some smokers may be, not smoking inside the house, and they may be going out and smoking. And even, their lifestyle may not be as sedentary as somebody who's, not smoking and just on the couch and watching television and spoiling life. So that's different. But then otherwise, if you see, the smokers will have reduced exercise capacity as well, and they cannot exercise that much. So smoking has ill effects on all the organs of the body,